Hello, my name's Marie Delph and I'm a hypnotherapist and an NLP practitioner and also a reflexologist. And over the last 4 years, I have been working on a new technique called Hypno-Zone Therapy, which integrates the three different concepts. So what I wanted it to start to do was to work on the story or the program that your client is running alongside their condition. I want to work on where that comes from. Now, as reflexologists, we have the ultimate gift in that we can see where the physical side of your client's condition is impacting by looking at their feet, by finding the clues. But we can also see the emotional side through foot reading, however much you have studied foot reading, whether you've actually done a foot reading course or not, there will always be aspects there that you're reading about your client through their feet. I wanted to take it another step further in integrating the NLP techniques that I've learned to establish at consultation level what program your client is running about their condition and how much they've been conditioned to have a condition. So quite often, we come across clients who come to us and say, well, everybody in my family's got a bad back, or my mum suffered with terrible migraines, so I guess it's hereditary. Now, how much of that is hereditary and how much of that is them being conditioned to expect that they will have migraines? So what I start to do with this is at consultation level, by using solution-focused approach and solution-focused questioning, to start to initiate change at consultation, start to offer them the idea that this can be remedied, that this can be sorted, that this doesn't have to be the way that their life will be. They do not have to live with pain or different levels of pain. So at consultation level, by using a solution-focused approach, we can start to break down the story that your client comes to us with. So it will be a story that they've told themselves hundreds of times and that they will have told other people hundreds of times. Now, the thing about your subconscious or your unconscious is that it listens to everything that you say and everything that you think. So every time that message is said out loud, or every time that message is thought, your unconscious is listening and it's reacting. And it's giving you or your client what it thinks you're asking for. So at consultation level, we start to break that down. We find out what the story is and we start to change it. I then will teach during this course a technique where we can speak directly to the unconscious without hypnosis. We can ask it questions and we can get answers. We can bypass the conscious mind and speak directly to the unconscious. And it will work with us. That's so cool. We can do that. Also, as reflexologists, what we have is the ability, and we as reflexologists do it with 90% of our clients, to put our client into hypnosis. When they're in the chair and they're so relaxed and you're there rubbing their feet, they're in hypnosis. So what I want to do is I want to utilise that. It's the perfect state and we're not using it. So I want to use that state that we as reflexologists naturally instigate through our treatment. So by using really gentle techniques, really calming, relaxing reflexology techniques. I work bilaterally, and there's lots of sedation goes on. The beauty of it also is that we can, we have the advantage over hypnotherapists in that we can sedate if we feel our client isn't deep enough or is becoming, you know, more aware of their thoughts. And we can you know, we can bring them out of it a little bit, or we can take them further into hypnosis purely by what we're doing with the feet. Hypnotherapists don't have that. You know, we have that. It is such a gift. So we're going to use that. I'm going to teach you some hypnotherapy techniques. I'm going to teach you how to work content free so that you are allowing their unconscious to do the work. Because this isn't a hypnotherapy course, it's a Hypno-Zone course, okay? It will allow you to work as a Hypno-Zone therapist. It won't allow you to work as a hypnotherapist. So by working content free, we're not telling them what they should be thinking, or we're not telling them a story. We're not putting them into a situation that is our doing. We are allowing them to go to a place where they can do the work, and the unconscious will let go of what it needs to let go of that's attached to the issues that they have, and a whole lot more. Okay. And also, you know, going back to the foot reading, the beauty that we have as reflexologists is that we have an insight into our client that no other therapist gets. You know, if you've done even the most basic foot reading course, or you've read one of like wonderful Jane Sheehan's books, or Moshe's books, or Samuel Bellier, or anybody like that, you know, you've got an insight into that client that probably they don't even have. You've got an insight into their history, into their childhood, into their relationships, you know, into their work, into their marriage, into everything, into the way that they think about themselves, and also into the way that they process and program things. So what we can also do with Hypno-Zone Therapy is we can work on that in a content-free, completely safe way, you know. So I think it's the ultimate, you know, therapy, and it's the next step, because particularly with COVID, particularly with the way that the world is at the moment, you know, we're dealing with anxiety, we're dealing with people with depression, and we're also dealing with people with many physical conditions. So this therapy works on every level, on the emotional and the physical. So if you'd like any more information, please let me know. Please get in touch. I'm happy to help. And hopefully I'll see you on the course. Thank you.